stupid as this sounds, it would be a lot less frustrating if I was at the bottom of the list. So when you're at the top with like 160,000 people, that's terrifying.
The surgical and diagnostic backlog continues to grow in the province as Doctors Manitoba now estimates the backlog sits at over 161,585 cases, an increase of over 7,700 from the last month. Of the estimated backlog, over 52,000 Manitobans are waiting for surgery, 42,500 Manitobans are waiting for diagnostic imaging procedures, and well over 66,000 are waiting for other procedures such as allergy tests and mammograms. City News spoke to one Winnipegger who is waiting for much-needed surgery for kidney cancer. Their desire was to remain anonymous.
It becomes from simple operation with a great prognosis to inoperable or heavy chemotherapy. These are just the very scary parts of it.
They tell City News that seeing operations at a standstill while the backlog continues to increase is extremely frustrating.
To see what was going on from it and that they're shutting down like operating rooms, laying off staff, and not running full surgical rotations is, I don't know, it seems very foolish.
Manitoba is loosening restrictions and getting rid of both the vaccine and mask mandates over the next few weeks. The question is, when will the backlog get better?
We still need to be COVID cautious.
Doctors Manitoba President Dr. Christian Thompson says hospitals are continuously overflowing and are in a critical state. More than 2,500 COVID-19 patients have been admitted into hospitals over the Omicron wave in Manitoba, which is about 40 patients per day. Dr. Thompson says he doesn't have a crystal ball to predict the future, but says this may get worse before it gets better. He is urging Manitobans to continue following public health orders even after restrictions are lifted.
What we see is, the effect of Omicron and its effect on hospital surge capacity and seeing just how disruptive it's been in terms of having to reroute staff, to ICUs, to hospital wards to address staffing shortages.
After numerous calls by Doctors Manitoba to the government to address the surgical backlog, Health Minister Audrey Gordon announced in December that a task force would be established. But so far, the task force has only appeared once in the last 2 months. We reached out to Minister Gordon for comment. A spokesperson tells City News that the province is committed to updates and will be providing one in the near future. Manitoba NDP health critic Uzoma Azaguera responding to the significant increased backlog. Quote, the PC's failure to take care of families living with pain and uncertainty is inexcusable. They've done nothing to address this problem but make empty promises.
This is worse than the way they phrase it.
In Winnipeg, Alex Karpa, City News.